Let's talk a little bit about childhood trauma. So this has been a topic that I've been covering all month long on Instagram and on TikTok. And a lot of you are still asking me a lot of questions about whether or not your experiences were traumatic. And my answer to that is always, well, it's relative. And I know I talked about this in a previous video, so if you haven't watched that, I'm gonna go ahead and link it up here so that you can go watch that, and then you can come back to this video. Because in this video today, I'm gonna be going over the ACE assessment. The ACE assessment stands for Adverse Childhood Experiences. It was a research study conducted by the CDC in order to study these adverse childhood experiences and health outcomes. So the ACE assessment is broken up into three main categories that they assess for. And the first category is abuse. So the abuse category, in this one, we're looking for emotional abuse, physical abuse, and sexual abuse. The second category is household challenges. And household challenges include questions about whether or not your mother was treated violently or appropriately by other members in the household, substance abuse in the household, mental illnesses in the household, if there was a significant separation or a divorce, or if anyone in your household was taken to prison. And the third category that the ACE assessment assesses is neglect. That includes emotional and physical neglect. So this assessment is made up of 10 questions that assess in all of these areas. And for each answer that a person answers yes to, they are given a score of 1. And then they add up the scores at the end. And what they found was that over 60% of the population in the USA had at least one childhood adverse experience. What they found was that as the number of ACEs increased, so did the adverse outcomes. And some of these adverse outcomes include things such as risk for depression, anxiety, PTSD, or any other mental health disorder, increased complications with pregnancy, increased susceptibility to contracting an STD such as HIV, increased risk of cancer, increased risk of asthma and pulmonary disease, and even lower opportunities in education and job opportunities in the future. One of the outcomes that was really significant was the outcomes in relation to suicidality. What they found that men who had an ACE score of 4 or higher and women who had experienced an ACE score of 2 or higher increased their risk by attempting suicide at least once compared to those who didn't have those scores. So in general, people who have an ACE score of 4 or higher when compared to those with 0 ACE scores were 2 times more likely to use substances such as drinking or drugs, were 3 times more likely to become smokers. They are 5 times more likely to engage in sexual intercourse prior to age 16, 6 times more likely to have unwanted teenage pregnancies, 7 times more likely to be involved in violence, 46 times more likely to be a user of IV drugs, and 35 times more likely to attempt suicide. Those are big numbers. As you can see, having adverse childhood experiences can significantly not only impact your mental health outcomes in the future, but it can also impact your health outcomes. So what are these questions that are on the ACE questionnaire? I'm gonna go ahead and read them off to you right now so that you know what is on this assessment. Now, the issue is that this assessment didn't even include other types of traumas, such as being bullied at school or moving around constantly. Now, what you need to keep in mind as I read off these questions is that this assessment asks for these experiences prior to age 18. So you're looking at between when you were born up until age 18. So that's what we're assessing for. So as I read off these questions, when you're thinking about these answers, you want to ask yourself, did these things happen to me before I was 18 years old? Before I get started with these questions, I want to let you know that this could be a trigger warning. So take caution as you move forward. I'm going to be reading off of my questionnaire that I have here so that I don't miss anything and so I don't word the questions wrong. So I'll be looking down to read these questions to you. Okay, so let's get started. Number 1, did a parent or other adult in the household often or very often swear at you, insult you, put you down, or humiliate you? Or act in a way that made you afraid that you might be physically hurt? So you would answer yes or no to that one. And if you answer a yes, you get 1 point. Question number 2. Did a parent or other adult in the household often or very often push, grab, slap, or throw something at you, or ever hit you so hard that you had marks or were injured? Same applies. If you say yes, you get a point. If you say no, no points. Question 3. Did an adult or person at least 5 years older than you ever touch or fondle you or have you touch their body in a sexual way? Or attempt or actually have oral, anal, or vaginal intercourse with you? Same scoring system. Number 4. Did you often or very often feel that no one in your family loved you or thought you were important or special? Or your family didn't look out for each other, feel close to each other, or support each other? Number 5. Did you often or very often feel that you didn't have enough to eat, had to wear dirty clothes, and had no one to protect you? Or your parents were so drunk or high to take care of you or take you to the doctor if you needed to? Number 6. Were your parents ever separated or divorced? Number 7, was your mother or stepmother often or very often pushed, grabbed, slapped, or had something thrown at her? Or sometimes, often, or very often kicked, bitten, hit with a fist, or hit with something hard, or ever repeatedly hit over a few times or threatened with a gun or a knife? Number 8, did you live with anyone who was a problem drinker or alcoholic or who used street drugs? Number 9, was a household member depressed or mentally ill, or did a household member attempt suicide? And number 10, did a household member go to prison? Those are the 10 questions on the ACE questionnaire. Again, for every one that you answered yes to, you get 1 point. And the higher your score is, the higher your risk is for developing mental health issues or even chronic health issues, even including cancer, autoimmune disease, HIV, AIDS, or lung diseases like asthma and obstructive pulmonary disease. As you can see, these did not include some of the things that I discussed in my videos on other social media platforms to be considered traumatic that could happen before age 18. So in addition to these, we recognize that there is so much more that could have happened that could have impacted you in a negative way. Now, as I also mentioned in my previous video, is that just because you experience these does not mean that you will always be traumatized. In addition to these things, there's also something called resilience factors. So the resilience factors are things like, did you feel loved growing up? Did you have someone to turn to? Did you feel accepted and appreciated? Did you feel safe? So some of these things may have happened to you, but you may have also had all of these other resilience factors there that may have made things slightly easier on you. But if you didn't have any resilience factors and you also experienced a lot of these, then it could explain why you might be struggling so much with your mental health. So if you found yourself answering yes to a lot of these questions, or even just more than 2, then again, remember, your risk of developing a mental health condition because of these things are so much higher. So please talk to a professional about this. Mention this assessment. Talk to them about your childhood, and you can definitely grow and become resilient through these. This is nothing in mental health is a life sentence. We are definitely growing and evolving beings that can continue to develop both physically and mentally. So always remind yourself of that. Nothing you are given is going to stick around like that forever. So getting the right help, talking to the right people, having the right support system is the best thing that you can do for yourself if you found yourself answering yes to any of these questions. And as I've mentioned earlier in other videos, therapy is for everybody. Therapy is not for those who have just experienced bad things. Therapy is for you if you feel like you just want to better yourself, if you want to have a place to vent to somebody who is not biased, somebody who can keep you accountable, or also when you have traumas or a mental health disorder. But I don't want you to feel like because you didn't answer yes to any of these that you don't deserve therapy, because everybody deserves therapy if they want therapy. And you may not even be aware that some of these things may have happened to you. I can't even begin to tell you how many times I have worked with people who thought they had amazing childhoods until we got down to the nitty-gritty. So I don't want you to dismiss yourself. If you feel like something's going on, if your self-esteem is low, if you're having bad mood swings, if you're having suicidal thoughts, if you're feeling depressed or anxious, there's something going on, and we can definitely work with you on that. So again, find a professional in your area that can really help you work through these things. I really hope that this video was informational for you. I hope that you found it helpful and useful. Drop your questions below. What questions do you have about this? Have you heard of this assessment before? Let me know in the comments, and I'll see you next time.